All right, so we'll start. Shall I turn the, oh, you got that? Okay. Okay, good morning, everyone. We're going to start our time together. Oh, I got to watch out for that, the projector. And I'm really excited to be part of this wonderful opportunity to connect with SAY San Diego in this beautiful facility. I've learned today about how a year ago they moved in here. So congratulations, and wow, you should be very proud of where you are, and it's great inspiration for the rest of us who come from all parts of the county or of this region together to learn about how we do our work together, not just in San Diego, but across the Southern California region. So I'm going to peek around. Oh, there's my poster. I just want to highlight that we're here today as a region. I am personally from San Luis Obispo County. My name is Lisa Fraser. I direct our Child Abuse Prevention Council, which is called Center for Family Strengthening. We are a nonprofit, and like many of you in this room are nonprofits. We have evolved and formed our projects and our efforts over the last 20 years to be more of a presence in our county, and I'm always looking for ways to connect with my colleagues throughout this region, and here we are today through Strategies 2.0. So as we get ready for the day, I want to just announce where people are from in this effort. But next, I just want to announce that Lydia over here is part of Strategies 2.0. She does training. I know she's done training in this area, I think even in this room, from Strategies 2.0. And Natalie Rhodes, and Natalie is right there behind us. And she is the one who actually talked with a lot of you to invite you to be part of this day. She is the coordinator of all things, and I am the person who just gets to come up and speak with you about my role here, as well as we all have like roles in our different parts of the region. So from each county, we have multiple remote places, but I want to first just remind everybody why we're here. We're here today because we've built a theme around this series. This is number 2 of a series of 4, and we are focusing on revisioning prevention, which is, I could hear it even I was talking with Joe Burley, just hearing about the new network that's going to come on. You're going to hear more about that later, how we're always evolving, and we're looking at and exploring systems of innovation and best practices in the prevention of child abuse and neglect. So that's our theme for this series. And you're here today for number 2. So our participants, besides those of us that are here in this room, and we have folks in San Luis Obispo County at the Center for Family Strengthening office, my office, and Gwen Garcia is the coordinator of what I call Parent Connection. It is our countywide parent education project, and she's there making sure people behave in that room and show up. And Ventura County is my colleague, our colleague, I would say to all of us here, Kathleen Van Antwerp. And Kathleen is the director of the Child Abuse Prevention Council in Ventura County, but they're called Partnership for Safe Families. And we've known each other since she came on board about 1.5 years ago, and she is on fire and really working hard to pull together all the key stakeholders in that county to be around this focus of child abuse prevention. In Los Angeles, we have Sarah Lacroix, and Sarah is at the Magnolia Place. Has anybody know about Magnolia Place? I'm going to check. I see some heads going up and down. Okay, so that is an incredibly innovative approach down there in downtown Los Angeles. I've been there myself a couple times, and it's really exciting to see what communities can do. And instead of having a building that's more like this is more of an office type complex out here, Magnolia Place used to be a warehouse for trucking. And they built it into what it is as a community or family resource center in downtown Los Angeles. It's really cool. I would say also we have, Okay, I lost it. There it is. Okay, there it is. Riverside. Welcome.
Hi. Just observing too long.
Oh, that's fine. No, you're fine, but we're welcome. We also have folks in Riverside at the Family Service Association, and today I learned that one of our participants today, Alyssa, you're here today, and she was, this is her first time with us, and yet she'll be on a panel later as well, and she got referred to this from her colleague in Riverside, so thank you for that. And we are also, I forget how many people online, Natalie, do you remember?
25.
20, so, okay, people are sitting in their offices, in their comfy little place, maybe in their pajamas, I don't know, but you know, they're listening and being part of this, and they can see what we're doing here today. So the camera is over here, just so you know. And then also to be mindful that when we are in a place where we're asking questions, we have a microphone, okay? And please remember that when you start asking a question, no one will hear you from the online audience. And so we'll try to remember to make sure you get that microphone in your hand. All right, so I think for the day we have some very exciting opportunities to connect with each other. But what we'd like to do quickly is for you to turn to someone that you don't know. And I want you to just spend a minute, and I want you to introduce yourself to that person that you don't know. And I want you to share your favorite season of the year and what do you enjoy most about it. So it's a minute, and if you could just find that person you don't know, share your favorite season of the year and what you enjoy most about it. Okay? I know you. Here, I don't know you. I don't know you.
What's your favorite? I'm Katrina.
Katrina?
Yes.
Hi, it's good to meet you.
I think my favorite season, I'm a Californian, so I feel like fall and winter are all kind of like one season.
They are.
But this time of year is mainly because
It is.
It is. I see my family.
So you enjoy it for that reason, just because it's a festive.
It's just all the best things are like this time of the year.
Yeah.
There's so much like celebration and families.
Yeah, it is.
My birthday, so.
We do bring that up this time of the year about the value of families. And again, what is your role? What do you do?
Oh, I apologize. I'm an intern with San Diego.
Oh, you're an intern. In which school?
Denver University.
Which one? I'm sorry.
Denver University.
Say that again.
Denver University.
Like Denver, like Colorado.
It's an online program.
It is, okay. You threw me down just for today, but you're right. In San Luis Obispo County, we have folks from BYU, Idaho. It's an online program, and USC has in their master's program. We have students that do that online. Yeah.
It works best for me because I also have a full-time job. So.
Where do you work?
As I don't know if you're familiar with New Alternatives. They're more San Diego based.
Yeah. Okay. Well, all right, good. Well, thanks for coming. I'm glad they let the intern come and get introduced to this work that we do, which is great. We're glad to have you on board. Okay, if you can hear my voice, clap twice. If you can hear my voice, clap twice. Thank you. And thank you. Wow, I'm so grateful that you got so involved. I get the room and the energy just went up, and I could hear everybody enthusiastically just getting to know each other, and I got to know my person really well, and thank you for all of that. So we are at that time of the day where I have the pleasure and the opportunity to lead into our focus presenter. And Charles Wilson is someone who I got to know by phone, just like a lot of you. We talk on phone, we talk on GoToMeeting or Zoom, or recently I got introduced to Google Hang. Anybody do Google Hang? That's really a fun one too. And as we get to prepare for a day like this, we're always a little, not nervous, you know, because you're putting on like a show, right? And you want to make sure you're all comfortable and ready. And at the same time, we have an online audience that we don't get to see, and a remote audience that we want to make sure we are including them in this dialogue. So, but I'm really excited because Charles has such a calm way of talking to the audience and to us that it just is very reassuring. And at the same time, as I've gotten to know Charles, he brings a wealth of knowledge and experience that I didn't know about until a few minutes ago. So thank you, Charles, for this time that you're spending with us. So in here, in this day, we really want you to come prepared to just learn a little bit more about evidence-based models for preventing child maltreatment. And the Center for Evidence-Based Clearinghouse is one of those resources funded by the Office of Child Abuse Prevention that does that. Now, those of us who've been doing this a while, and I'm one of those, I've been coached, I have been mentored, I have been supported for the last 20 years by the Office of Child Abuse Prevention. And it has evolved just like I have and like all of us. The Office of Child Abuse Prevention is the funder of Strategies 2.0. And that is the project that is making all of this possible today. So, as you can see below, we have logos, and the logos represent the directing partners of this Strategies 2.0 project. So the Child Abuse Prevention Center of Sacramento is a partner to this. The Children's Bureau of Southern California is a leading partner on this. And then we have the San Diego State University Social Policy Institute, and we have representatives here today that are part of that as well. They're the ones that are leading and working with all of us to meet the mission that you see up here and also in your handout. So Strategies 2.0, I'm just going to do the little commercial here, is they do trainings, yes, and they have specialists that consult on the work. Whatever's unique in our region or your county or your community, they're prepared to work with you. And Lydia is a trainer and a consultant, but today she's our technical grip. The DJ. And learning communities that we're here to do, this is our 4th year. And this is very, now we feel like we're seasoned, but it's still very newish because it's not a training. We're here to network. We're here to learn from each other. And that is the vision of the learning community, is to make it possible for us to come together through this table. But also we have our colleagues throughout the region, like we pointed out. We've got people we have 9 counties in this region. We all have important relationships that we want to foster and encourage. And this is one way to make that happen. So we want to develop our cross-sector partnerships, not just with government agencies, but with all of us who are in this work in whatever capacity that we do. We have to constantly address our organizational capacity to do this work. Like moving into this beautiful building, it just didn't happen on a whim. It was carefully planned, right, Joe? And thought out, and and then the moment you get in, yes, you have all this extra space, but then the challenges are all the technical part that made it possible to get here is pretty exciting and challenging. So this brings me to how we wanted to remain with the theme of understanding our systems of child abuse prevention work and how do we inform ourselves. So when I go back to San Luis Obispo County, when I started this in 2000, I didn't have the capacity to do email and internet. It didn't exist. We just had faxes. That's how far along it's been for me personally to evolve. I could not connect with communities or counties like we are doing today. And I have to say, the annual conference that happens here in January in San Diego, that was one of my first go-tos that really got me to be with my people. And thank you for that. I know this is Charles. It's your last conference, right? So we were really lucky because not only did we get to have this great resource from Charles to talk about the California Evidence-Based Clearinghouse, and it's sponsored by Office of Child Abuse Prevention. But Joe reminded me today that he is retiring after this. So thank you for being with us. And we know he's going to still be active in some consulting ways, so don't forget that he's around, because I'm sure he likes to stay busy. And so I'm just going to hand this off to Charles and let him introduce himself to all of us and talk about the work that's being done and how we keep on our toes. So thank you, Charles. For you, I think I'm going to have to give him the lapel. And I will take it. There you go. We only have one to share it. See, this is
Okay.
good at. I'll hang
Thank you.
off at the time.
So, as you heard, I'm Charles. I have been around a long time. I actually started working around child abuse and neglect in 1972. I actually remember the minute, literally the minute, I decided this is what I was going to do with my career, when a TV commercial came on TV when I was a student teacher at the University of Miami, going to be a secondary educator. But this camera had little babies crawling towards the camera, and it just played kind of nursery music, and made you kind of smile seeing the babies, and the voice said, "Who had hurt a little child?" And then they rolled the statistics for the year before, and quite frankly, I was a lucky kid. I didn't know child abuse even existed. So there was something unfair about that, and the families that have to struggle so that I said that's what I want to do for a living. So now I've been doing that for a number of years. I was a CPS worker, then a supervisor, manager. I was the director of child welfare for Tennessee for about 14 years. Then moved into the child advocacy center world. We're working around child abuse and neglect in a multi-scenario environment in the private side. And that brought me to San Diego 20 years ago. So at Rady Children's Hospital, which is our big children's hospital here in San Diego County, I oversee behavioral health. But my day job is what's called the Chadwick Center, which is our response to child abuse, neglect, and child trauma. And we have a number of projects. One of those is the California Evidence-Based Clearinghouse, and that's what I've come to talk about today. This particular project's beginning goes back to when Gray Davis was governor of California. And Governor Davis and the leaders of the Department of Social Services at the time recognized that there was a lot of room for growth and improvement in child welfare, and convened a group of what were referred to as stakeholders. And in that group of stakeholders that I was lucky enough to be one of, the question arose, if we're going to reform child welfare, maybe we should actually look at what the research says. Now, that doesn't seem like a radical idea, but in the early 2000s, it was a radical idea. No one had actually talked about the term evidence. And in fact, the term evidence-based practice didn't exist in child welfare's language or social service language. It was a term used in medicine only. But those who've been in California a long time know that Gray Davis was kind of a boring governor, and he got recalled for, I couldn't figure out any reason other than he was boring, and Arnold Schwarzenegger, who wasn't boring, became the governor. But from that, one of the things the Schwarzenegger administration did was keep this notion of, let's create this resource. So this has been live since 2006. The California Evidence-Based Clearinghouse is used by people around the world. About 1 million people, well over 1 million people have used it now in over 209 countries. 30,000 people in well over 100 countries a month use it. So it's a resource that's available to you. It's free. And as you do strategic planning, as you do implementation, as you do case management, as you make referrals for services, it's a resource that can be used on multiple levels by family resource centers and CAPCs and other organizations working in this field. So I'm going to give you kind of a quick walkthrough, because we have a limited time to pack a lot of stuff in. But the mission of the clearinghouse is to advance effective implementation of evidence-based practices for children and youth families involved in the child welfare system. And why that's the mission, because it's paid for, as you heard, by the Office of Child Abuse Prevention. It is equally relevant for people serving other children and families that aren't related to the child welfare. So it still is beneficial. So the child welfare system in our state advisory committee, which is composed largely of county child welfare directors and former child welfare directors and people that work in affiliation with them, they get to pick what we look at. They don't get to pick the content. They get to pick, look at this issue, look at that issue that is relevant for children served by child welfare. But most of what's on the clearinghouse is of interest to educators, of interest to mental health professionals, social service providers of all variety. And it really has two faces. One is the original clearinghouse focused on helping people find what are practices that have strong empirical evidence that are worth replicating. If I'm going to do something, what's the best way I can do it? An example, Amy knows well, is here in San Diego County, the United Way of San Diego County got interested in child abuse and child abuse prevention. And where would they put their money to make a difference? And so we used the clearinghouse to lead us to a decision to use something called Project Safe Care. And the county took the United Way funds and put a bunch of other money in, and now we have a whole network of service providers that came out of the decision about, if we're going to do something, let's do something that has evidence that it works. And so we're going to go on the clearinghouse, that's before we finish talking today, but the classic clearinghouse helps you find programs. It looks for name brand programs and rates them on a scientific scale, how strong the evidence is. But it turned out, after we got into this, that picking a program is kind of the easy part. It's actually implementing it. And how do you actually take it from an idea into practice? Coincidentally, since the clearinghouse went live in 2006, a whole new kind of area of science has evolved called implementation science. It's really caught on. And so there's a lot of research going on about how you implement things. So that part of the clearinghouse, the selection, the implementation, is bringing the best information from implementation scientists together that can help individual practitioners. And the whole point is take this science and make it accessible for people that don't have to, have spent years and years in graduate schools and sorting through the, as we sometimes say, how many angels can dance on the head of a chi-square. I mean, all these researchers can get in all these debates and stuff. So we kind of make all that mysticism go away and kind of make things practical and useful for people that don't live and breathe in academia. So first is, if we're going to have evidence-based practices, what does that mean? And quite frankly, it's become a marketing term for people. They realize that, evidence-based practice is better, so they declare their program evidence-based and they try and sell it that way. But evidence-based isn't just about the science. We actually borrowed the definition we use from medicine, and people like Dr. Sackett and others who were kind of pioneers in this area. And this particular definition was by the Institute of Medicine that we use, which is it's the best research evidence mixed with the best clinical experience. So it's not just good enough that somebody in an academic setting has got good research. How does it work in the real world? How does it work clinically? And it's consistent with family and client values. Because if we come up with something that is absolutely perfect and we try and apply it on the Crow Reservation in Montana, and the actual intervention is offensive to the culture, then it's not going to work for them. So how does all these things, and it's really the sweet spot is right here in the middle. When we have the best science linked to solid clinical experience mixed with consistent with family values, client values, then that's the area that's kind of what we're targeting at. Now, we really can't day-to-day assess all the different cultural groups that would exist. So we can't say, we can't rate how it's consistent with clinical values. That's a decision in your selecting programs you need to make. The practical experience, there's some measure of that, but the piece that we can measure the most is really how strong is the research. And so we rate the research on a 1 to 5 scale. 1 is our strongest. That's well supported. So 1 on the clearinghouse is, I'm going to walk through these in it, is good. A 5, bad. That's at the lower end. Not only does it not work, a 5 would be something that actually makes it worse. So a 1 rating on the clearinghouse, which is, again, the highest rating, means there's 2 or more randomized clinical trials. In at least one of those clinical trials has shown that after the intervention stopped, if you wait a whole year, it still is effective. The gain didn't go away. So take something like trauma-focused cognitive behavioral therapy, which is an intervention we use in mental health for traumatized children. The research shows us that if we implement this model, we can actually make trauma symptoms drop significantly. The research also shows us is once therapy stops and the child goes on about their life, a year later, the symptoms haven't come back. So that's how you kind of earn a 1. Now, not everyone is going to be familiar with some of the terminology. So a randomized clinical trial is basically a research study where you take a population of similar patients or clients, you have an intervention you want to test, an evidence-based practice, and you randomly assign the people in the pool to either the treatment group or to the control group. The treatment group gets the thing you're testing. The control group in classic medicine may get a placebo, a sugar pill. In social services and mental health, typically what this group gets, the control groups, is whatever they would get anyway without the intervention. So in the community, what would someone with this particular disorder, this particular social problem, this particular issue, what services would they normally get? And let's give them that. So that's called services as usual. So they're not really at a disadvantage. They're getting something that they would get anyway if we weren't running the study. And then the people that are in the treatment group are getting whatever new thing you're testing. And then you follow up and see, is there a difference? And if the treatment group actually comes up with superior results than what you were getting from services as usual, that's a significant thing. And you can show you get better. It doesn't mean everybody gets better, everybody improves. But if this is a statistically significant improvement compared to that, and to do that, you have to use valid and reliable measures. And terms like reliability, does the measures they're using consistently measure things over and over and get the same results given the same factors? And valid is they're measuring the right thing. If you're trying to prevent child abuse, for example, but you're measuring some other variable, so you're validly measuring whether they can drive down the road and not get speeding tickets or something. It doesn't actually, it's maybe reliable, but it doesn't tell you anything about what you're trying to get at. So you're looking for valid and reliable measures. So for 1, we want 2 or more randomized clinical trials, sustained effect for at least a year. A 2 on the clearinghouse is almost as good. That means there's at least 1 randomized clinical trial, and it showed sustained effect for at least 6 months. What we find here is some programs. There's a program developed in San Francisco that was extremely well regarded, had multiple randomized clinical trials, but up until recently, all their studies only measured 6 months after the end. So they, that wouldn't get to a 1, no matter how many trials they are, because they'd only measured for 6 months post-treatment. So a 2 is still very strong. A 3 tells us that there's some evidence it works. They have some sort of comparison group, a control group, where they measured it, but maybe they didn't randomize. Maybe they're using wait list or what's called a quasi-experimental designs. But they essentially, they compared their intervention to a control group and found it worked better than service as usual, or they compared it to another practice that's on the clearinghouse is a 1, 2, or 3 and found it worked as well. So if something is a category 1, like nurse-parent partnerships, and you have an intervention like Safe Care comes along and they get as good a results, they don't have to be better than nurse-parent partnership to get the same score. They have to be as good. So 1, 2s, and 3s tell us there's some degree of evidence, 1 being stronger, 2 being less so, and 3. meaning there is some evidence. The fourth, level 4, basically shows we couldn't find an effect. The research has been done, and it's not any better than services as usual. They're getting the same results. Doesn't mean it's not a good thing to do, because service as usual may be working too, but they can't find it's superior to the practice it's compared to. And a 5 would be something that actually makes it worse. Now, interestingly enough, we know some 5s, but they're not on the clearinghouse because they weren't among the topics that were selected. Does anyone know a well-known intervention that actually looks like it actually causes more harm than good? Anybody here Scared Straight? Scared Straight was developed in Rahway, New Jersey. Prisoners had the idea, send us some street kids that are in trouble, early offenders. We'll scare them. We'll make them not want to come to prison. And so they bring kids into prison, and these guys get really scary in their face, and they make them want to, these kids are shaking and scared. And when they leave, does it scare them out of a way of crime? No. They're more likely to commit a crime. Why would they be more likely to commit a crime? You want to hazard a guess?
They know what to expect.
Well, they know what to expect, but the other thing is, if you're a 14-year-old tough kid and you rule the roost in your junior high school and the elementary school, you're the tough kid, and now you've been made to feel helpless and scared. Who do you want to be? You want to be the guy that can make people scared and afraid. You identify with the aggressor and more likely to commit crime. DARE, drug resistance program. Seemed like a great idea. Millions of dollars are spent on DARE and DARE officers and DARE cars and all these DARE stuff. And kids are actually more likely to use drugs after DARE than before. So there are things out there that are well intended that actually backfire. The actual largest number of programs on the clearinghouse, and we made a decision early on in the clearinghouse that we would load programs that we review, whether we were able to rate them or not. So we call it truth in advertising. If someone's out there and they have a program that's not rated, that doesn't have any real research, but they're saying it does, you can go there and find out, oh, is this program really, what do they actually have? What research do they actually have? I once had a program director call me up. He was trying to speak at the January conference, and he was upset his paper hadn't been presented. And I explained, well, you don't really have any evidence that your program works. Basically, he had made it up. And he said, I'm listed on the California Evidence-Based Clearinghouse. He not realizing that we were the California Evidence-Based Clearinghouse. He said, yeah, but you're listed as unable to rate because you have no research. A key issue here is to get, there's no reason to think it's bad. There's no legal or empirical suggesting it's actually harmful, but it doesn't have any peer-reviewed published research. And peer-reviewed published research for getting on the clearinghouse is important because we require you to have your research published there. So it's not good enough to have a research study you paid someone locally to do and it's sitting in your drawer. It actually has to make it through the peer-reviewed published world. I don't know if anybody here is submitted for peer-reviewed published research, but or papers, but it's a little like this cartoon. You have to go through rounds of reviewers, and these blind reviewers who don't know who you are and you don't know who they are criticizing it, asking you all sorts of questions, and so to finally get it in a good publication, your methodology, all that stuff has to be pretty solid. On the clearinghouse now, we have 35 programs rated at the highest level. We've been actually analyzing and doing this stuff and building the clearinghouse since 2006. So we have 35 ones, we have 52 twos, we have 140 threes. So if you kind of look at that, you got about 225 programs that have pretty good research that are on there on a variety of different topics I'll show you. We only have 1 4 and 252 programs that are out there actively being marketed to child welfare and to community agencies as programs that should be replicated that are unable to rate, that don't have any research published with any type of control group. So just because someone says they're on the clearinghouse or they talk about it being evidence-based, if you're interested in referring to it or bringing it into your agency, it'd be wise to go check it out on the clearinghouse, and there's some other resources you can check it on too. But be sure you know what you're buying. Because this is the social service child welfare-based clearinghouse, we also look at how relevant each of these programs are to child welfare. With high being they use child welfare clients in their research, and low being they use kids that weren't particularly like that. So if you're going to be working and trying to prevent child abuse, and you're doing it with active child abuse cases, or child welfare cases, you're going to be high. If you're doing it in Grosse Pointe, Michigan, with private school kids who live in $5 million houses, you're probably going to be low because their problems are different. And we measure and look at the key issues of safety, permanency, and well-being. Now, there are hundreds of models we've looked at, but we've arranged them into 48 topics. And those topics are clustered into, so if you go in the clearinghouse, as we will, you can, anger management, domestic violence, substance abuse issues are clustered together, behavior management, including parent training programs, something very relevant to family resource centers, are clustered together. Core child welfare services and placement reunification for child welfare agencies together. Engagement and parent partnering programs, another issue I think would be very relevant for family resource centers. Mental health, prevention and early intervention programs. Amy and I were talking about a project they're going to do, which, looking at expanding prevention programs is a great topic area to look at, as well as support services for youth in the child welfare system. In each program, everything we look at, we provide a rating, a brief description. We determine whether there's a manual or training available for somebody who wants to do it. We look at delivery, how long it needs to take, what type of people need to be working at there, what's the qualifications for the staff, how long does it last, what language is available. We live in a very, very diverse environment. If you have a program you really want to do and you're working with Chinese immigrants in the Bay Area who don't yet have good English skills, then having an intervention that's only available in English with written material for the families would be of less value than if you have one that has translations. Resources and requirements needed to run the program. What does it really take to do it? And then we provide a review of the literature. We also have, on this clearinghouse, in addition to the programs, we've looked at measurement tools that people use with these children. We started and then we backed away from looking at measures used by mental health practitioners, all the psychological tools you could do, and really focus on those that can be used by child welfare workers or community agency workers to screen children or to assess children and families. And so we look at those tools, those for children and those for families, things like ages and stages or the protective factor survey that many of you use apparently. I've read the harder survey on family resource centers, so I had some sense of the tools that people use here. And so you can use this program or the registry by looking up a specific program, by looking at a topic area, by the rating system. There are multiple ways you can go around this, and we'll go on the website shortly. But finding the right programs is part of the task. The second challenge is how do you actually implement it? This is not so clear cut. It's not like we can rate this implementation program versus that, but there is a growing body of scientific information there. So we try and develop information that will help a county or an agency develop the array of services that best integrates evidence-based practices to meet the unique needs of their children and their families. We also provide a lot of consultation to counties who are interested in trying to improve the strength of their programs. And we recognize that whether it's county or an agency, before you start bringing in something new, first look at what's going on inside the organization. Are there effective programs you're doing right now? And you just need to expand them. We found programs that are working really great in one part of the county, but they're not available in another part of the county. So rather than bringing something new in, why not move that one to the other part of the county as well? If you have a program, excuse me, that is, you're convinced is working really well for you, but it's not, quote, evidence-based, we would encourage you to build the evidence. Rather than throw it out and go do something else, let's find somebody who will help you study it. There's a program in Brevard County, Florida, that contracted with us to come in and assess their programs and really help them think through how they manage this big umbrella organization. And Brevard is Cocoa Beach and Cape Canaveral, that area of Florida. And they had this model that they were really proud of, and so we encouraged them to do this, and in fact they did it. Now they're now on the clearinghouse. It's not an easy thing to do. You've got to actually do the research. You got to get it published. But so it takes several years to do it well, but it can be done and has been done. If you're looking at trying to do something to increase the effectiveness of your programs, the place to start is with a needs assessment. Identify what program populations you're focusing on. What are their unique needs? How does that fit with your agency goals? We also look at what barriers and gaps exist in services, either programmatic barriers, volume barriers in that you got the right program, but you have a 6-month wait list for the next slot, or you don't have it in the right geographic locations. And then develop a plan to move in a more evidence-based way. The needs assessment is starting with this, just like we do. There's a fair amount of parallel process here. I assume most everyone in this room who assesses families looks not just for the deficits, but for their strengths. So start with your strengths. What strengths do you have and your community have? What are the things that are working well? How are the services, your services, align with your framework, the structure in which you have to organize your resource and your organization? And what strengths and challenges do you have? And then how can new practices impact on that? So in the Harder study, this is for the Family Resources Centers, there are a number of frameworks that, like the protective factor frameworks that were reported out by FRCs to the Harder researchers. But you can take that assessment, that framework, and really kind of assess your family needs. Protective factor survey, looking at when families come to you, clarify what their strengths are. What types of programs are going to be a good fit for them. Examine what's going to improve over time. So you measure, you're kind of assessing things along the way. There's a quality improvement technique that's pretty simple called Ask Why 5 times. Here's an example. Child abuse is reoccurring for parents after parents completed the evidence-based training program. So you had a training program, but they're still getting referrals. Well, ask why. Well, looking back at why they're coming back in, well, there's a lack of supervision. And it's neglect-related, child abuse reports or child abuse and neglect reports coming in. But why is that going on? Well, parents report that what they learned in the training wasn't all that useful. Why was that? Parents were referred to parenting programs designed to address disruptive behaviors. A lot of the parenting programs, which are evidence-based, aren't designed to prevent child abuse at all. They're really designed for parents dealing with highly disruptive children, not the things that are the source of neglect. It's the wrong parenting program for the population. So referrals, then we also found that even though this particular example, the agency and the organization had the right mix of programs, they were assigning people to the closest program, not the correct program, not the program that best fit them. So you just ask why 5 times becomes it. There was a Central Valley County we were working with that wanted us to help them bring evidence-based family reunification programs in to support kids going home, because they were sending children out of foster care and they were coming back into foster care. So we used this exercise with them. Well, why do you want to do that? Well, they're coming back in because of neglect. Okay, well, why is that going on? And then it found out, well, they have substance abuse issues. Okay, So the family unification program wouldn't help you with a substance abuse program. You might need a substance abuse program. Why do they have substance abuse programs? Because they have huge trauma issues. No? A substance abuse program designed for someone who's not a primary trauma victim may not be as effective as a program like Seeking Safety that actually is designed for that population. So you drill down trying to understand how you're going to, what's really driving the problem you're trying to fix. Because it's easy to take this first answer and go out and try and bring a program, but think of all the effort you bring in to introduce a new program to your organization, only for it to solve the wrong problem. Looking at the best fit, I mentioned Safe Care earlier. When we first went live with the Clearinghouse, parenting programs was one of the very first things we looked at. And clearly the gold star, top of the line intervention was nurse-parent partnerships in terms of home visitation programs. Registered nurses go in the home, they follow the structural protocol. It's been tested in multiple states, and it seems like the best fit. So the question is, if we want to have child abuse home visit prevention programs that are home visitation oriented across the state of California, let's just add that. Let's just expand that. But when we sat down with OCAP and others, actually with Greg Rhodes, who's the director, and thought through the issue is, well, what's the challenge with that? Well, a lot of the families we want to go to are comfortable in their own language, not necessarily English. And we have a national nursing shortage, and nurses cost a lot of money. So are we going to find enough RNs who speak Spanish, for example, who are working in Imperial County, California, who are willing to go into really tough communities? That may be a bit of a challenge. But we had this other statewide network of home visitation program called CalSafe that used baccalaureate level trained home visitors that were there. It's just that program didn't have that strong evidence. And so we then went back and said, well, it turns out the #1 highest rated program isn't the best fit. What's the highest rated program that uses this workforce we already have, who already speak the languages we need to speak, who already are comfortable going in those communities and are effective and are known? Well, that brought us to Safe Care, which didn't have quite as strong a research, but it was a better fit. So it's about fit as much as rating. Now, the CEBC itself, we actually do provide consultation and support with agencies, with county departments. It's free. You can call on the phone and just talk to the staff. There are a bunch of resources, video conferences, trainings available, but just a consultation, is available. And we've worked throughout the whole state doing types of things, helping counties move forward, helping individual agencies. So an agency wishing to try to decide whether a new home visiting program, we can help introduce them. We can do a video conference to review the agency's data. We can send our recommendations. We can follow up. We can do Skype types of calls. So that's available. OCAP's already covered the cost of it, so it's all free. One of the issues with evidence-based practices is people think, well, my population's different, and it's not going to work with mine. The research was out somewhere over in the East Coast, and we got different people. Well, the best research tells us that most of the evidence-based practices move very comfortably across cultural lines. Stan Huey, who's at USC, is one of our scientific advisors, has done all sorts of research doing meta-analysis where he's pulling like the African-American kids out of multiple studies and putting them together and reanalyzing to see if it's just as effective for them as a group when you get a large enough sample to make a statement. And find that for African-American and Latino, which there's enough population showing up in various studies, consistently it's just as effective. So we can't quite make the same scientific statement about Native American and Asian Americans because there are fewer numbers showing up in the general studies of research things. But there's no reason to think it won't work either. But you may want to adapt it. And so the issue is, if you're going to adapt something, you might, to increase the fit, you're probably better off working with the developer if you can to make those adaptations. You might try the basic model first and see if it works. But you might discover there's some things you might want to do. So the safe stuff to do is minor adjustments to make it more receptive. Changing names to make them more feel comfortable for the community you're working with. Tailoring the languages, scenarios, any pictures you're using, things that make it feel like a fit for your population. Those are all safe. Doing modifications that more change the components require a little bit more thought and probably touching base with the developer, depends on what it is. But for example, colleagues at the University of Montana working with Native American communities who are doing trauma therapy with traumatized children. There's something called the trauma narrative you do in trauma-focused cognitive therapy. They do it during the sweat lodge ceremony. And so they're tying the cultural piece to a practice that's empirically tested. If you start changing core components, changing the whole theory behind it, you really wander the field. It's kind of like when you go to your pharmacist and your child's sick and you want some amoxicillin, they'll ask you, do you want bubble gum or cherry? I mean, they're going to flavor it. It doesn't change amoxicillin, it just changes the receptivity of it. But if the pharmacist said, that amoxicillin works kind of good, but I'm going to put some other stuff in here. I think it'll work even better if we just put this in here. They might poison you, your child. It may not work. And so you don't want to go, changing the active ingredients that make it uniquely effective, or you'll lose any ability to predict how it's going to come out. So before we talk about Families First Act, can we go online for a minute? Do I come over there because I have to negotiate with the mouse, I think.
Joe, will this reach over there? Do you think?
So.
Okay, let me pull it up for you first.
Okay, fine, right. So if you go to the website, California Evidence-Based Clearinghouse is www.CEBC4CW. So California Evidence-Based Clearinghouse for Child Welfare. That's where that comes from. This is the homepage you'll see. So list, give me a couple problems to choose from that are typical of families that you're running into. Besides just financially, they need more resources. What types of emotional, mental health, parenting problems, whatever, do people?
Substance abuse.
Okay. Parental substance abuse?
Yes.
Okay. So what's another related issue?
Homelessness.
Homelessness?
Mental health. Mental health.
Mental health? Okay. What type of mental health? Oh, sorry, you were supposed to be talking to the microphone. What type of mental health?
Anything from depression to anxiety to wider substance abuse.
Okay. So let's take, we have history of homelessness, we have substance abuse issues, and we have mental health issues. And quite frankly, I think we all find that those overlap each other not infrequently. So how might the clearinghouse help you? Now, this can help on two levels. One is you're in a leadership role or you're having input into leadership decisions in your organization, and you're thinking, what do we want to add to our repertoire of services? What practice do we want to bring in? Again, that Harder study indicated 83% of the Family Resource Center in California said they were doing at least one evidence-based practices, and 31% said they're doing at least 3. So if you want to add an evidence-based practice to help address some of these issues, what might that practice be? The clearinghouse can help you. If you're an individual practitioner in an organization and you're going to refer, you're doing a case management, you're going to refer that family to something, the clearinghouse can help you figure out what to refer them to. because then you can find the programs that look like they work and then search in your own community to see what's available. So let's take those particular issues. And we're going to go to the find a program. This is the registry. Now, on the registry, there are a bunch of just PDF guides, how to do things, how to read things, individual documents, desk guides, things like that. Understanding evidence-based practices goes back in the detail of those 3 overlapping circles I talked about. The CEBC review process explains how we get there. All the people involved in reviewing this, who are the scientific advisors, who are the raters, what criteria we use for those who want to understand that. But for the most simplistic purposes, and the fact that we only have 14 minutes left, we'll look at programs. We can search by the name of a program. Is there a name of a program you wanted that you're already aware of that you wanted to see if it works? Okay, so if we don't have that answer, then we go to topical area. This table needs to be taller, I need to be shorter. These are all the topical areas we might look at. Alternatives to long-term residential care. Important issue, but not relevant to what you're looking at. Anger management for adults. If we had thrown DV in there, we might want to look at that. But if we had harsh punishment, things like that, that might be a place we want to look at. Anxiety treatment for children and adolescents, attachment interventions for children and adolescents, behavior management programs for adolescents, bipolar disorder treatment for children and adolescents, casework practice, child welfare workforce, commercially sexually exploited children, depression treatment adults. That's one you wanted to look at. So let's look at there. So it turns out in depression treatments for adults, there is one, let's see, rated programs, 1, 2, 3, 4, 5 programs that actually have the strongest research. And then if you want to understand one of those, it's hard to do this at this angle. Where's the mouse? Oh, there it is. I'm colorblind too, so then these colors make it harder for me. For each program, so this program, and this is not an area for, because I work with kids. I don't know the adult side all that well, so I'm reading this with you right now. But this is a program, CBT for adult depression. It's a well-known program. You get an overview of the program, and then you can find, well, what is that, when you're weighing your options, if you're going to focus on depression, you would kind of pick these options. You can look at program goals. What's the program supposed to accomplish? Essential components are like the essential elements of a medication. It's what makes this a unique thing. If you're not doing these things, you're not doing this particular practice. We don't know from a research point of view if all these ingredients are necessary to get the effect, unless they've done what's called a study that's designed to take out individual components and test it again. Few programs have done that. So, but these are the essential components of this particular practice. You get questions of program delivery, its intensity, what it's for, where it's typically delivered, what type of homework is available, what languages is available, what resources are necessary to run the program, what type of training is available, advice from the developer on implementation. Now, this is different than the implementation website. This is this developer saying, here's what's been useful for implementing this program. So it's unique to this individual program. All right. What got it to research? Now, there's an annotated bibliography of all the studies that have been published that were used in the rating. Then there are additional references that are not research papers. There may be books or other articles that just describe it. And if you want to decide, after you've done your review, you want to know more about doing this and seeing what it would cost to bring it to your community, then here's the person you call to get that. Now, that level of detail and more is available on 380 models that's on the Clearinghouse. So you can just kind of look up what you're looking for. Going back out, let's go to so our family we're dealing with had concerns about substance abuse. So here you've got only one program that's rated a 1. Then you have multiple 2 programs. And then you have 6 programs like the most common one, AA, been around all this time, has never been able to do, never done a truly randomized clinical trial that showed it worked. It shows it works compared to comparison group, but they haven't actually done the same level of depth of research. So you may find very common things listed lower in the category. Now, when you get to not rated, you notice there's nothing listed there. We decided to do that because it almost made it like it was just like another one of the rated programs. It gave it criteria. But if you want to know what the non-rated programs, you just click on that and it pops up. So all this information is available for you to dig on any problem you're struggling with. Some programs lay out neater on this format than others. So I mentioned trauma-focused cognitive behavioral therapy before. Well, their essential components are a nice, neat thing where they have the term practice that explains each critical component, and it spells the word practice. It's nice and neat. Some of these other folks have really never thought about what their essential components are, and so they have a harder time articulating it. This information, the content, is a combination of what the developer provides us and what our research staff, how they adjust it and edit it. So we have developers who disagree with what we say, and they can appeal it. We have some that argue. We've had a few programs that, like functional family therapy is a well-known program, but there are 2 competing interests who argue who owns it, and they're threatening to sue us and sue each other because we mentioned the other person and not them. I mean, there are always politics among these people, but at the end of the day, it's just a few mouse clicks away to get all sorts of information here. On the implementation side, if you just did one thing, click on this one, and you can download that publication and read it at your leisure. There are several versions or several approaches to frameworks for implementation science. We are drawn to one called EPIS. And EPIS is developed by Greg Ahrens, who's here at University of California, San Diego, who's one of the top implementation researchers in the country. EPIS is exploration, planning, implementation, and sustaining. And so it's a structure to think through how you, from your very first exploration, you're also thinking about how we're going to sustain this. So it all kind of gets linked together. And so we've done studies actually with SafeCare. We had 2 different studies. We had a federal grant to spread SafeCare around California, and then Greg had a CDC grant to test implementation style. And we randomly assigned counties to those 2 different conditions and implemented it and found it was a very successful and useful tool to do that. So that's kind of the clearinghouse. Now, there's some recent, if we can go back. Can we flip back to the slides? Oh, so you need this. So it was an interesting compliment. A few years ago, we were alerted that the Senate had introduced a bill, the U.S. Senate, to set up a prevention clearinghouse, and that they had adopted all our language. So the criteria for what's evidence-based on the California clearinghouse is now written into federal law with some unfortunate tweaks, as federal law often has unfortunate tweaks. And that bill passed, I think it passed the House and not the Senate, and they got stuck for a couple years, and then all of a sudden it passed overnight. And so it's now called the Family First Prevention Services Prevention Act. First thing to understand about the Family First Prevention Act is it has nothing to do with preventing child abuse. It's about preventing foster care. And so the use of the word prevention confuses people because they think this is going to be about prevention of foster care or homelessness or mental health or something. And it's really focused on preventing the entry into foster care or the re-entry into foster care. But there are a lot of parallels with the clearinghouse. One, what this law, and I don't know how many folks are familiar with it, but basically what this statute is going to allow is for states to take Title IV funds. Title IV funds were traditionally there to pay for the maintenance of foster care. So you had to be in foster care. And this act is allowing the states to take this and move it downstream to get it before children come into foster care, to keep them out of foster care. Why that's significant is Title IV money is an entitlement fund. It has no, if the state wants to, it's a matching relationship with the state. So let's say the state wants to have $100 million worth of program supported by Title IV, and that 75% of that in that state, because each state is different, is matched by the federal government. So they're only having to spend $25 million to get $100 million of programs. Does that make sense? With entitlement, the state next year decides, let's invest another $10 million. They then, the federal government doesn't have to appropriate it. Well, they have to appropriate it, but it's entitled. So the state spends $10 million more dollars, it draws in $30 more million federal dollars. And so it's not capped like it is Title 4B money that OCAP uses. So what happened? It's not the same. There we go. So we are not directly involved in this. It's being run out of what we refer to as a Beltway bandit firm outside of Washington, one of these folks that do a lot of federal contracting. But we are in frequent contact with them. It does use our clearinghouse criteria, except for they don't require that peer-reviewed literature. They can take a dissertation, they can take a paper out of a local evaluation or something of that nature. But they rate them differently. They also allow studies that don't have the highest level of research that we would require to be at the highest level that they have, because they may not have the randomized control group. But we are in frequent contact with them. But their funds are designed to prevent children from re-entering or entering foster care and directly related to safety, permanence, and well-being of children, or to prevent entering care. And it's what's going to qualify is defined by the states and their state plan that goes to the state. Now, if I understand it correctly, and you know it better than I do, but my understanding, California has postponed implementing this to 2021. Part of that was before this law passed, there was an opportunity for states to have waivers. California had a very successful waiver program they liked, and this changes it. So they're using that as a transition period to do it. To be eligible for these funds, infant, children, youth, pregnant or parenting youth, or birth parents, kinship partners, providing temporary or permanent care for children all qualify. And for at risk of entering care or disruption of adoption. So it gives some flexibility for this money. Because it's designed to keep you out of care, the concern was that you would get one shot at this, but you can get multiple sequences of it. And there's no income requirement for the family, so it's not Title 4E actually had its origins in AFDC decades ago in terms of eligibility. Its focuses on 3 areas: prevention, focused on mental health services, the issue that you guys brought up, on in-home parent skill-based programs, and substance abuse and prevention programs, the issue you brought up. So it's very relevant for the issues you guys are struggling with. So down the road, as California develops its plan, many of the program agencies in this room might want to advance providing services, but the focus isn't on keeping the abuse in the first place. It's for families that are active to child welfare who are at risk of going into care. Their criteria is a lot like ours. There has to be a book or manual. Has to be no empirical risk of harm. The way the evidence supports the benefits has to be better than not. Have to be valid and reliable outcome measures, and no case data services that suggest that it's harmful. Example of that would be years ago there was a program that dealt with children who had major attachment issues. And you would send them to this place in Evergreen, Colorado, and they would do what was referred to as holding therapy. And their theory of change was they'd wrap the child with adults, pillows and blankets, and the child would have to struggle free as if escaping from the womb, only to emerge from the womb, and there's the face of their foster parent or adoptive parent. And it would help bonding, because these are kids who didn't have bonding. Problem was 7 kids died doing that. And there was no reason to think it was working. So it was actually outlawed in multiple states. So that's why we have to worry about, there are things that can actually cause harm. In some cases, actually kill kids. How does theirs compare to ours? It's basically the same, other than you don't have to have a book for us. I mean, if you have trainers who will come and do training, that's good enough. It's the way the evidence is the biggest difference. They do a different analysis of because they're not relying on peer-reviewed literature exclusively. They do lots of things like power analysis and things like that to try and sort it out. So theirs is more labor intensive. Consequently, it's a lot smaller. So we have 380 programs on the clearinghouse. They've got 11, of which only 8 are rated. So these are the programs that they've looked at and rated so far. So a state who wants to implement this new statute and use these funds can use these funds only for these programs: for functional family therapy, Healthy Families of America, which is a home visitation program, multi-systemic therapy, which was really designed for juvenile justice types of children involved initially, nurse-parent partnership, I mentioned it before, it's a home visitation program with nurses, Parents as Teachers, program that maybe you guys are probably familiar with. It uses teaching the parents to be involved early on in the child's educational experience and build that connection. Families Facing the Future, methadone maintenance therapy for substance abuse. That obviously is an important issue for heroin addiction, but the research and the way they're viewing it is not as strong. One that's puzzled most everybody is trauma-focused CBT, that even on their website, they have multiple strong studies, but for some reason they only rate it as promising, but it's still something that's fundable under this, which is the only trauma treatment up here. 3 things that they were looked at was a KinTech and Kinship Care Navigator. Specifically, the statute wanted them to look at kinship care navigators. There's no research to show they work. They don't show they don't work either. It's just they haven't done the good research yet. And then MST, which is multi-systemic therapy, the child abuse version of that, they rated as not meeting their criteria. So right now, those are the ones that you could use funds on the Family Services Prevention Act. These are the ones they're currently reviewing. So the numbers will go up over the next year. But there's some familiar looking things there that most all these things are on the clearinghouse. And so you can get a head start looking at, everybody has these slides, right? Yeah, so you can go on the clearinghouse and check them out before they show up here to see if that's strategically something you may want to pitch as a family resource center. They may come up with a different conclusion than we did, but it'll give you a head start. And this is a timer Jennifer put at the end. I have no idea why it's there, but it times down. Because technically I don't have 4 minutes anymore. So that's a quick 1 hour walkthrough about a bunch of stuff. So I hope it made some sense. And thank you.
Thank you, Charles. So we want the opportunity for you to ask questions before you leave us. And I'm looking at the group here. Masha?
Hi, thank you so much for that presentation. Okay. I had kind of a two-pronged question. One, with all the most recent social science, they've been finding that the studies have been peer-reviewed. When they try to repeat them, the outcomes don't come the same. So I was curious, with the clearinghouse, is there any kind of effort to double-check the peer-reviewed studies that have already been accepted to make sure that the outcomes are going to be the same? And is there a double-checking of the raw data that they submit that's based on their peer review paper? That's the first question. The second question is, there's going to be any kind of effort to do any kind of geomapping of the programs to see where they are currently in the United States?
So let's do the first one first. In terms of kind of test, retest, whether things continue to have the same results over and over again. We have a preference for multiple studies by multiple authors. So that's one way to kind of control for that. We don't go back and have them and reanalyze all their data. That decision was made. The type of review the clearinghouse done is not the same as what's called a systematic review, where you're looking at everything and redoing everything and kind of analyzing. We would be, part of that is volume, depth versus breadth. So with working with OCAP, we wanted to have a broad impact across a large range of topical areas. So we do depend on major journals to do the reviews and kind of the analysis and things like that to get through that peer review process. It's not an infallible process. People, reliable institutions have done some flaky things over the years. So yeah, that's a limitation of the clearinghouse. We've not reanalyzed their data or had them send us raw data. Obviously, with 380 programs, we wouldn't have been able to do that very consistently. And the second question, which was?
I was curious if there's at any point.
Oh, geomapping. Yeah, we actually played with that idea. We found it was flawed. We tried it for about a year. The problem is we didn't know where everything. It was hard to figure out where things were actually occurring. And then we discovered places that said they were doing it, somebody left and they weren't doing it anymore. And so keeping it up to date became an impossible task. So it never actually went live on the website, but we were doing it behind the scenes to see if we could do it. And there was just so many variables that made it we didn't think it was reliable.
Anybody else in San Diego here with a question for Charles? This is your opportunity. I'm looking to our online audience and checking in with Lydia over here if there's anybody putting a question into the chat box. So we'll give them a moment to shout out.
At the end of January, come to the big conference.
That's true.
It's actually looking like it's going to be the largest one we ever had. The hotel is sold out.
Already?
Already. There are
wow.
Over 1,200 people already registered, and it's still 2 months to go.
Oh, wow.
And 40-something countries.
Wow, 40 countries. That's remarkable. Lydia, anybody from our remote sites or online? If not, okay, I think we're good. Charles, thank you so much. A little round of appreciation for Charles. And we'll definitely, I'm going to go by and check out the Chadwick Center after this meeting today. I got a little invitation I'm going to take advantage of. And I appreciate you being with us. And good luck.
You would have gotten Jennifer, who actually runs it day to day.
Mm-hmm.
She was supposed to be in Ecuador because we were helping them set up a clearinghouse down there.
Oh, wow.
But then that trip got canceled, and for some reason she went to Disney World instead of coming here and doing it. Yesterday.
Well, I hope she has fun on the happiest place on earth. So this is an opportunity. We're going to take a break, okay? So we'll be back here. I know we went a little over, so let's try to be back here by 11, and then we'll do the rest of our time together. Thank you. Okay.
That made some sense.
It did. I know about it, but I know way more and more confident now because of it. Thank you. Thank you, Charles. I'll do that. Okay. Yeah.
San Diego Spotlight, a little bit about, say, the one information about the economic utility use in San Diego County.
Oh, cool.
So I think that's perfect. It fits right in, and we'll just segue into the panel. And so still that 15 minutes for both of them.
Okay. So I'm thinking about, should I lapel him and give her the mic as well, or should they just share the mic?
Well, that might make it easier if he's lapelled and she has the mic.
Yeah, I'm just thinking out loud about that. So I will use the mic to bring people back in and then have him put this on right now.
Yes. I'm going to get a table for the panel.
And that whole hour and a half, Jerry's everywhere.
I mean, I'm not surprised.
Yeah. They're zero maintenance, yeah.
Danny? Yes. Hi, Lisa. Thank you for being with us.
Do our best to make today.
So Joe, when you come back, I'm going to put back, I'm going to use the handheld mic.
Yeah, I will use that one too. That works.
But you want to share this with Kim?
Yeah, I mean, we can both just stand right. I can talk and then give it to her. Does that work?
That's what we were here, that's what I'm here to
Okay.
discuss. So
Yeah.
it's either you get this or you do that.
Yeah, we'll do it.
Okay,
I
that's
think.
fine.
Does that still work, Kim? I'll do a little San Diego fun facts. Cool stuff that you shared. I don't know.
Oh, really? Yeah. Should I go grab them? I have some in the car. I think I have them out.
Yeah, I know that we have, I'm one of the 22 counties that did this, and I have my economic report, but it's fun to see the others and just get really clear on our similarities, not so much, but it's nice to hear the numbers, because in San Luis Obispo County, we have the numbers we have, obviously, and we compare them to Santa Barbara County, which is right next door. It's interesting because Santa Barbara has far fewer referrals than us, yet Santa Barbara is a much larger county population. Why? We don't know. We like to think it's because we have an active mandated reporter community, but really why? We're half the size, like half the size. You know, what is it? We're 53,000 kids under 18, and then in Santa Barbara it's about 100,000. So, yeah, that too. It's true. That, you know, Santa Barbara is so good. And the parts of Santa Barbara County that are closer to San Luis Obispo County, yeah, we're like this together. It's Santa Maria, Lompoc is the community, Guadalupe.
My best friend lives in Lompoc.
With who?
One of my best friends lives in Lompoc.
Oh, really? Oh, see, there you go. So they're all, but you're right. In the past 20 years, Santa Maria and Lompoc have been growing so quickly, their population, and yet the services have just recently started to rise up in that region of the county, because there's like a good 40-minute drive between Santa Barbara and Lompoc, right? And San Luis Obispo, or Santa Maria. So, yeah, all right.
So do you know if the prevention teams are getting together again this year at the conference, or I haven't heard anything, so I'm assuming we're not.
I haven't heard that. No, I have, but I imagine that it will occur. Yeah, I'm sure. Did you go up in Sacramento?
That's something else in
Yeah.
Sacramento.
It was helpful. It was helpful. It really, they highlighted counties like Napa and Ventura, I forget the other one, that where they were, and it validated what you were doing. Was for us, for me personally, it was like, okay, we're going in the right direction here. And at the same time, some of the counties are really on board, and others are like struggling a little bit. You know, after the honeymoon period, you know, big party in San Diego, and so. But I'm bringing on an intern from the Masters of the Public Policy program at Cal Poly to do this, to work with us. It's just not
There's only
possible.
so much you can do without extra resources, right? I mean,
Exactly.
It's great to bring together partners, but everyone's really committed to their extra resources to kind of keep it moving along.
Yeah, it's, so the network that Joe was telling me about that you're going to organize with some funding.
Yeah, the Children's Bureau.
So that's separate, different from what the planning team is doing?
Yes, we basically are expanding what we created as a result of the prevention.
Oh, cool. Oh,
Yeah.
gosh, that's really great to hear, because when he was telling me, I thought, gosh, is it a separate?
It was a solid part of our application that like this team already exists. This is what we're doing. These are the partners. We want to expand this to become a little bit more partners. So I mean, I don't know if we would have gotten it without that kind of showing that foundation.
Where'd the money come from?
Children's Bureau.
Of
HHS.
At the
federal. Yeah.
the federal. Okay, because when we say Children's Bureau, there's the Children's Bureau here in California. So yes, I am aware of it, but you know, I always, because of the size county we are and the not enough minutes in the day, I never think about that as a resource for funding.
Yeah.
Okay. I will go there.
It's great. Yeah, it's completely in line with what we created at the summit last year.
So when did you apply for that? Do you remember what not what day, but?
I think it was due in, I know when it was due. It was due in May.
Okay, I know that one.
Community collaboration.
Yes.
And child abuse.
Yeah. Our Ventura colleague and Santa Barbara colleague and ours, we did try for that, but they just kicked us early out and said, no, you're not worthy.
Oh.
No. I think it's just that we were too small of a, even though we think the three counties together made an impression.
Yeah.
But I'm glad to hear that you did, and we made this connection. I will be sharing that with my Santa Barbara and Ventura partners. And,
yeah, it was interesting because we're coming from the early childhood, like childcare, primarily ECE space, and we were the only team at the summit in January that had ECE at their table.
Right.
And if you remember when everybody stood up at the end and said, "What are you going to do when you go back?"
Yes.
Almost all of them were like, "We're going to go get our childcare partners." So that was really neat because that was not usually in those conversations.
Correct. Yeah.
Right?
Yeah.
But it was just good to hear that it kind of made everybody go, well, I guess this is a missing partner.
Yeah. I mean, I sit on our child care planning council, so I wear that hat, but I'm not really the decider of those things. But yeah, you're right. That's very cool to have that at the table.
So only resulted in good stuff.
All the way.
All right, I gotta go put on my facilitator. And we're gonna come to our part of the, oops, I'm going in the wrong way. There we go. So Joe and Kim are gonna come join us, and they're going to introduce to you Say San Diego. That's where we are today. Welcome back, everybody, from online land. And we're going to hand you both the mic and introduce Kim.
Yeah.
And you've got your 15 minutes of fame here, so go for it.
All right, sounds good. I'm going to do a little overview, and if I understood my assignment correctly, also some kind of fun facts about San Diego for folks that are watching from farther away. And then I'm going to hand it over to Kim, who's with the executive director of the YMCA Child Care Resource Service, and they're kind of spearheading some really cool work, kind of a regional prevention group here. And so obviously wanted to give them some of the statistics of what that looks like for the region and what they're going to be working on or spearheading. So a little bit about SAY. So our kind of mission and focus is really about opportunity, equity, and well-being for a lot of the folks that we serve, and that really is done kind of partnering shoulder to shoulder and kind of coming alongside folks so that they can reach their full potential. SAY is probably 30 plus programs, and we have over 400 staff all across mostly the city of San Diego, but we have programs all over the county as well. And I do organizational planning there, and one of the kind of cool things that we've been working on as an organization over the past couple years is really thinking about what is our kind of key performance indicator or prevention framework that we can connect and really tell a better story about the work that we're doing across a lot of those different programs. And so we looked at the social determinants of health, our kind of county live well indicators, the protective factors, and kind of crosswalk those into kind of 5 indicators for our organization. And so I don't forget them, I wrote them down here. So improving health and mental health, increasing knowledge, skills, and development, accessing resources, strengthening family and engagement in relationships, and then mobilizing vibrant communities. So that's a little bit about SAY. We're about to hit our 50-year anniversary coming up. And so it's been an exciting organization to be a part of. So again, thanks for joining us today. All right, the next part of my assignment was some fun facts about San Diego. So as you may or may not know, it is the birthplace of California. That was originally home and still home to the Kumeyaay people. And it was Juan Rodriguez Cabrillo who discovered San Diego back in 1542. And then I think California became a state later in like the 1800s. And ultimately, San Diego was really kind of a small, sleepy town until World War II, and really the military presence and footprint came. And since then, I think it's been growing. There are almost 1.5 million people and over 100 languages spoken. So I think, as we all know, it's the diversity of San Diego is what makes it exciting, and all of the great food and restaurants that you get, high quality food from around the world. I think that's one of my favorite fun facts, right? Industry-wise, obviously it's a popular tourist destination, but the other top industries are international trade, manufacturing, biotech, military, defense. And for example, at the border, over 70,000 people come back and forth across the border every day, and 25,000 people walk across every day. I was pretty surprised to find that out. And overall, kind of the global regional product and movement of goods counts for over $250 billion each year. So when you think about the importance of being in a border community, I think there's definitely lots of kind of great, exciting strengths in terms of what that brings to the region, and San Diego in particular. Other interesting things that it's listed as the top 10 fastest growing places for high-tech job markets. As you probably know, the largest concentration of military in the world. And let's see, another super random fact that I found is that San Diego has 7,000 farms, the most in any one city in the United States.
Wow.
So that's kind of interesting and cool as well. Let's see, anything else? I think as I kind of transition it to Kim here, I think for San Diego, I think the challenges are similar to a lot of other places, but living in Southern California, housing, childcare, transportation, and really just the high cost of living are all of those. And so obviously that even more, we all struggle with all of those things, and obviously that affects our kind of more vulnerable populations even more so. And so with that, Say and many others are excited to be a part of a new initiative that's happening. So with that, Kim.
Thank you.
You forgot to mention the Mexican food.
The Mexican food.
Yes. One of our best features in San Diego. So thank you for having us today. We are very excited to share with you a little bit about a new opportunity that we have through the YMCA Child Care Resource Service with many of our community partners who have been doing this work for many, many years. So about a year ago, last January, we were invited by our county welfare department to participate in a child abuse prevention summit that happened here at the conference in January. And it was a two-day event in which multiple partners from the community came together to think about how do we really move upstream in our work in child abuse prevention. And we were invited by Kim Giardina to participate and represent early childhood and child care in that conversation. So this work got started really in January when partners kind of set our vision, which was really to support caregivers for young children in managing kind of their capacity to manage social emotional health. And so we had a group that was meeting regularly, really starting to get work going, and an opportunity came out from the Children's Bureau to apply for a demonstration grant, and it was with the goal of building community collaborations to prevent child abuse and neglect. And so we thought we had already started via this Office of Child Abuse Prevention work, and so Amy, our genius on the team, applied, and we received the grant. So we received it in October, and it's really on behalf of the community, the San Diego community, and we are. It's a 5-year demonstration grant from the Children's Bureau with the goal of reducing entry into the child welfare system, so really upstream prevention. It is a 5-year grant, and we currently have probably over 20 partners that are already, have written in letters of support and intent to participate in the collaborative. So the goal of the collaborative is to really utilize the local community information exchange, which is 211's platform to to link families to social services. To really provide a safety net for families so that as families are transitioning between different social service agencies and different social service agencies are identifying family needs, we have a platform to refer those families. Part of that will be looking at using the Strengthening Families framework, so looking at protective factors and thinking about how we're assessing families for protective factors, how we're making referrals to support building protective factors, as well as the workforce. So doing some training for social service agency staff on culturally competent care, strengthening families, trauma-informed care. So we're all really working with families kind of towards the same end using the same framework. A third component of it is to provide early childhood mental health consultation. We know that preschool expulsion is a really big problem, and it can be a tipping point for families in which if they lose their childcare, they can lose their job, they can lose their home. It can really be a catalyst for some real stress in the family. And so we have proposed early childhood mental health consultation direct service supports via this grant, really to pilot some different models and think about how we can build the capacity in San Diego County to do this work. And that, I think, is pretty much it. That's a summary. So kind of a tiny bit about, some data around child abuse and neglect in San Diego County. So on the back table, you'll see this one pager that kind of lists some interesting facts. not fun facts, unfortunately. But in San Diego County, we have about 50,000 referrals to our child abuse prevention hotline every year. And of those, about 4,000 are substantiated claims. And the largest percentage of claims are for children 0 to 5 for neglect. So we know that we need to really be working in the early years. We really need to move very far upstream when parents are just becoming parents, and supporting families, in those early stressful times. So that is what we've proposed through this grant, and as well as our Prevention Summit team. So our prevention team is going to continue. It's going to really focus on the early childhood mental health piece of work, as well as preschool expulsion. And then we'll have other subcommittees that will be looking at different components, such as referral pathways and capacity building and that kind of thing. So we're doing a kickoff in January and inviting all partners that are really engaged in this work already, and thinking about how we can start on basically a landscape scan to identify who's doing what protective factors are we already really working towards, or what is our field already really doing well in terms of supporting protective factors, and what are areas in which we really need to build up our capacity as a community. And from there, we'll do our landscapes analysis and develop our plan. So, does anyone have any questions? Yeah. Okay.
All right.
Thank you.
Any questions from the online world? We want to encourage our audience out on the online world to please just post your question in the chat box, and Lydia will. Oh, there's one right over here. See, trying to run out of there.
Hi. I was curious. At the end of the 5-year, what is sort of the capacity building goal of this program to sustain it and sustain your efforts?
Well, the goal is that we will have a wide variety of social service partners engaged in the community information exchange,
utilizing the 211 platform with a capacity within each organization to really understand what are some of the questions we should be asking families, how are we assessing families for protective factors, how have we internally modified our referral practices, and how we support families in our service provision. So hopefully it'll be systemic change that won't necessarily need additional funding, because we as social service providers will already have changed our practices and our usage of the CIE platform.
All right. Any online questions from the chat box? Seeing none. Thank you, Kim. Thank you so much. So we're going to enter into the part of the day where we're going to have our guests from three agencies. I'm going to ask them to come up, and as they get settled, I want to thank Joe and Kim for giving us an update about San Diego and the fun facts. So please come up, Danny and Alyssa and Shannon, get yourselves nice and comfortable. And we have, oops, I've got to get over here. And always a little trick. Okay. So with us today, we have Shannon Throop. She is a licensed clinical social worker, senior director of the Child Abuse Prevention Services at SAY San Diego and Mid-City Family Resource Center. Phew. Thank you. And Alyssa Smith, who is she is a San Diego Region Program Supervisor with Safe Families for Children of Olive Crest. So that's going to be an exciting opportunity to learn more about that program. And then we have Danielle Romero, Senior Program Director for Safe San Diego, and his focus is with the Healthy Start Military Family Resource Center, which is quite fascinating because, as we learned in our fun facts, what a significant presence we have with the military here. But I'm also very aware that the military child care system is excellent. And of course, we'll have a little bit more information on that. So what I'll do, Danny, I'm going to hand this to you. And I'm going to ask the questions that we talked about earlier, and we'll take, just to be mindful of the time, we have till 12 o'clock for all three of you to answer 5 questions. And for our audience, the first question that we're going to ask, and then we'll hand the mic down, is please share with us, how does your program that you oversee include an evidence-based model and or an evidence-based informed or evidence-informed practice?
Fantastic. Well, pleasure to see everyone here today. Thanks for joining us online. So the program that I'll speak about today is actually called the Say San Diego Dads Core Program. It has been in existence in this community for, this is the 8th year since 2011. It's taken different names along the way. But as a Dads Core Program, it's really a fatherhood initiative to kind of work on involvement and reintegration, often with military fathers. You may think about this program through the lens of prevention because of the fact that when it comes to military families, the unique stressors of military life can sometimes lead towards child abuse. And the program that we strive to create is a way for fathers to kind of find themselves working in a new family unit, as well as reintegrating, as I mentioned. And so how we do that is we create an opportunity to share a meal with one another, and then engage into some parent-child activities. And then we follow a curriculum, which with the discussion earlier about evidence-based, we are right now utilizing a few different curriculums and blending them, as it is a non-rated at this point in time. And so you'll learn from my colleagues as to those that are fully vetted as to their validation behind the curriculum usage. But with Dad's Core in particular, what we try to do is create sessions where fathers have opportunities to gain parenting skills, while children as well learn social emotional learning, which is pretty prevalent in a lot of the San Diego Unified School District, which is some of the schools that we operate on. And so, you know, I feel like I'm going to talk for a while, but I'll try to nail down the points. Dad's Core utilizes pre and post assessments. We look at qualitative data from the clients that we work with, oftentimes with end of session kind of cue cards. We do our best to integrate the 5 protective factors into a lot of the assessments that we utilize. So we're really mindful of the language. We also utilize a retrospective post-assessment. And what we were finding over time is that we had to modify our tool to be able to work with fathers who, when they came into a program on their first day, perceived themselves as super dad, the greatest thing known to fatherhood. And what they quickly found out was that perhaps they did not exactly have the tools that they thought they had. And so a retrospective post-assessment is just our way of talking about, before this intervention or program, what did these kind of key indicators look like for your own performance as a father? And then following the program, what may have you gained over that period of time? So that has been something that's been very effective for us as we kind of build our case to become more evidence-based informed. And I'm sure we'll have more pieces from the guests with us.
Go right ahead, Alyssa.
Sure. So Safe Families for Children, we offer temporary housing for children whose families are in crisis. It's a totally voluntary thing that families can reach out for. We have 60 screened, approved host families that can offer out-of-home care. It's a way specifically focusing on social connection that families can choose to expand their support systems. We find that a lot of people are isolated, and we know that when people are isolated and going through crisis, that it escalates that crisis rather than de-escalating it, and that when you have additional people in your life that you can rely upon for support and trust, when you can build that out and have community, that is something that can really help and come alongside families. And we also know from the research that children having even just one functional adult in their life that retains relationship with them and builds into them is something that can have incredible impacts on adverse childhood experiences. So there's a lot of importance there. So including evidence-based practices, we also have a pre and post evaluation tool. It's on a 10-point scale that mirrors the protective factors. But we are still in the data collection phase of rolling that out and looking at what's showing up in the data. So we need time, we need years. We're a grassroots program that we are nationwide, but we're still in process. So it's still a learning. We're in a learning phase, and I love this community for that, for the value on learning and dialogue and gaining more information about how we can become better? What is the research? What are the findings in the research? What do we need to be looking at as even as small programs that want to be increasing our effectiveness according to evidence-based practices?
Thanks. So I work with a couple of different programs that utilize evidence-based practices. So one is called Project Keep, and Project Keep is a county-wide program that we offer group-based parenting, education, and support specifically to resource families. So that would be foster parents and kinship caregivers, and we offer that across the county. That is a model that we adopted when the program began in 2005, and it's on the CEBC and listed as a supported. So of that 1 through 5 scale, it's a number 2. So it's got a lot of research behind it, and we participated in some of the research protocols that have resulted in publications for that model. And then the other program that I oversee that has a kind of a heavy footprint in evidence-based models is the Community Services for Families program. So that program is funded by the county, specifically through Child Welfare Services. And it's available countywide, but it's broken up into 6 different segments. So Say San Diego has responsibility for oversight of the program in the central and north central regions. So that's specifically like the city of San Diego. And we offer a variety of different services, but specifically with regards to evidence-based programming, we have group-based parenting education, and we utilize the STEP, or Systematic Training for Effective Parenting model. That is on the 1 through 5 scale in the CEBC. It's a number 3. And we also utilize, Charles mentioned several times, the Safe Care model, and we utilize that for primarily our in-home parenting education. And it is a number 2 as well on the CEBC scale. So there's lots of, we've mentioned pre and post tests, there's lots of pre-post tests, there's lots of scales to make sure that we're following the program with fidelity. Safe Care has a very intensive training and coaching model program. So all of our in-home providers have ongoing training. We go through a 40-hour training program, as well as ongoing coaching that never ends. You'll be shadowed for life. But it's really how we make sure that we are providing the service with the level of fidelity that's expected of the model. So.
Perfect. Why don't you keep the mic?
Okay.
And we'll go to question number 2. So share with us how or have you integrated the protective factors into your program evaluation. So while you're doing this, we'd like to hear about what are the challenges and how you overcame them. And did you learn anything that surprised you about the families that you serve?
So yes, first of all, we do utilize the protective factor survey in the Community Services for Families program. We actually have an online data system where we collect the responses for the protective factor surveys several times over the course of services. Some of the workers would say it's maybe a little more often than the parents really appreciate. But I think that there's kind of a 2-pronged approach with it when it comes to this. I think that from a family level, it's really helped our workers identify areas of natural strength in the family, and maybe areas where we wouldn't have noticed it if we hadn't specifically asked those questions. And then I think that from a larger scale, it really gives child welfare as our funder an opportunity to evaluate the families that they serve and where they have some natural protective skills and factors, and where and how maybe our services are enhancing and augmenting those natural strengths as well.
Thank you. So some of the protective factors that Safe Family focuses in on, number 1, social connection, that this is about really expanding people's social networks, that when those are small, that there are many people that are in the community that they could be connected to, that could form safe places for their kids. And then additionally, parental resilience. One of the things that we look at in our post and pre-surveys is well-being for parents, and how do they can self-evaluate. What does that mean to me? What does my well-being mean to me? So building parental resilience, and then that concrete support of having individuals and people and receiving the services that they feel are necessary, doing collaborative work and connecting with other service providers that are, of course, offering a variety of services that families are needing to access. And then concrete support, meeting physical needs is one of the things that we look at. And then additionally, the social and emotional competence of children. One of the questions that we look at is family relationships, and have family relationships improved through the use of safe families, through the use of just expanding a support system, having a safe place for kids when people go through hard times, that they don't have to qualify for services, that they choose how they want to make use and access those things. And and the protective factors are, of course, so important. As I look at them, each of them are values that Safe Families holds, and I think that around the room that they are values that all of us hold for things that we want to see our programs doing really well.
So this will probably be more of an echo of what my colleagues have mentioned at this point, but as I mentioned with Dad's Core, we oftentimes utilize the 5 protective factors. And I think that, you had mentioned too in the question, what may have been, a part of the process of integrating those. And I think a lot of it comes back to language and how you share what each of those protective factors looks like, and providing perhaps not how we categorize it as providers, but speaking to the level of who we're talking to. So I can tell you with a group of military fathers, utilizing different language, you oftentimes have to go to what clicks and what makes sense in their world. So providing tangible examples of what those protective factors look like is something that we strive to do session by session, and asking kind of prodding questions along the way, especially I'm going to piggyback on the concrete support in times of need and social connections piece is probably the 2 main protective factors that we look at. Here's kind of the context by why we look at those in particular. You have to start thinking about the life cycle of an active duty member who may be 9 months removed from their family and then reintegrated, and then once again may go on a future deployment. So what happens when they're not in the home, and who is perhaps in the same community that they can reach out to or their family can reach out to? So kind of identifying those elements is really important to a lot of the work that we do. And with regard to kind of some of the other ways that we try to integrate it is really kind of with that case management piece of goal setting, and having fathers identify a personal self goal, a parenting goal, and a family goal at the beginning, and then have them work towards improvement, especially in terms of the involvement piece. As I mentioned, that reintegration is something that's huge. And often we talked a little bit earlier in these sessions about trends that we notice amongst fathers. We often find that the fathers that we're working with, while Dad's Core is open to military fathers, is also open to civilians. And so finding ways of making an environment where all feel welcome, is something that we strive to bring on a regular basis. And, I think the depth and breadth of cohorts is oftentimes from the first day, it's my wife signed me up for this, why am I here? To the end of, okay, we're going to have to move past check-ins because they want to talk about similar issues that they have. So that social bond, social cohesion is something that we see regularly.
Perfect. Hold on to the mic. We'll kick it off with you. So talk to us about how your organization addresses the topic of equity in your practices and program development. Do you include program participants in your program development and review process? And how do you address and remove barriers to program participant involvement in your organizational process?
Okay, so with the Dad's Core program, when it comes to how we integrate our program participants, is that we actually have an alumni group, and so this group serves as a steering committee, and they meet once a month to discuss the current cohorts, to discuss what's going well, as we're oftentimes piloting and tweaking our program approach, especially through the activities that we have, to kind of better understand, well, what actually had traction, momentum, and what was just a miss. And, I think that being experimental and piloting new initiatives requires you to think outside of the box. And some of the best ideas have come from the fathers that we're working with in terms of just activities that make sense, some things that they actually do with their children, as they're often better teachers than they think, or they give themselves credit for. And so the alumni group is kind of how we build in, their own buy-in into the program. And I think the other thing that I know we'll allude to in further questions is oftentimes knowing the program itself is only successful if we have locations that are accessible for all. And so oftentimes we utilize schools and create partnerships and different places where folks already congregate, as opposed to having them drive out to one facility that may be out of their range. And so that is what I can share on that.
When I think about equity, I think about just access for those who don't have access. And I think in the establishment of Safe Families, like at its core and how it was even founded, it's focused on providing for those and creating something for those that didn't previously exist, for those who don't have access to support systems, to safe people to care for their kids when they go through hard times, almost like creating family and friends network. And I think that's so important as we think about serving those who are facing multiple challenges with things that systematically disadvantage them, things that they're like oppressive things that are pervasive through multiple layers of society. These are really difficult things to address and meet. I like that Danny talked about just the need for expansion and growth, that we need to be located. The goal of Safe Families is that we would grow enough to be a neighbors helping neighbors model, that these would be people who are close, that live in their neighborhood, that can help them. We primarily are a North County, San Diego program in this county, but we're multi-regional in Orange County, Los Angeles, and in the Inland Empire, San Bernardino County, as well. So as we think about addressing equity within our own organizations, I think about just expanding support systems. I think about access. We don't have a wait list for our program, and I think that the fact that parents can self-determine if they would like this help, and then it's just a matching process of who can step in and what can be offered, and then self-referral too. It's not a mandatory thing that they can decide if they want to participate, and then no qualifications, no costs to them. They don't have to prove anything to be a part of it. They can just decide if that's something that that they want to do, and then including them in the program development. Safe Families started from continued interaction in the community with a child welfare services agency. Our founder just was continuously encountering families who were coming to the door of his agency saying, can you help me prevent what could happen? And I don't want anything bad to happen to my kids, and I'm struggling and I need a safe place for them. Can you offer essentially like temporary foster care? And in some professional terms, he would have to explain to them, well, actually that doesn't exist. And so this kept happening. And then from that feedback, from the community giving that feedback, it was like, there's no safety net. What if we created that? What if we created a safety net for kids whose families needed help on their, and then they decide what their terms are for that. They remain in control of the service that they, and is it a good relationship? Is it a good match? They decide. So it's up to them what they make use of and how often.
Thanks. So I think that kind of from the organizational level, SAY's done a really good job of recruiting community members to be part of our board. And I think that their professional and their personal experiences really help enrich our agency and help contribute to the development of different programs and how they can serve families. Specifically for one of my programs, Community Services for Families, we're incredibly fortunate. We have a parent partner on our team, which is someone who, in our case, has been through the child welfare experience in a personal level and has now come back in a professional capacity. She educates and role models for parents who are through the system, and she really helps us serve as kind of an opportunity for us to really stay centered on serving families and where we need to improve our our parent enrichment and our ability to, it just really is like a heartstone for the parent experience. We also utilize our satisfaction surveys, especially when it comes to our group-based parenting. It really helps inform us how important coffee is, and the fact that they really appreciate the fact that we offer free childcare. I think that we also listen to the feedback we get about the times of classes and when that's necessary for families, and how maybe a 6 to 8 p.m. class really can impact bedtimes, and maybe we need to look at that. So I think that we've really taken those opportunities to hear the feedback of families to better serve them, because that's really what we're here for.
Thank you, Shannon. Okay, why don't you keep the mic?
Okay.
And let's have you share with us examples of successful collaborations with a community partner in support of children and families.
So, I mean, the most glaring opportunity that I have to talk about community partnership is really our collaboration with our funder. And I know I'm not brown nosing here, I promise. So Child Welfare Services is the funder of our program, but they're also our primary referral source. And we share families, we work together. And so really, as the hub kind of case manager, that social worker with that family is vital to the success and to the progress of the family, and for us to be able to understand what their concerns are so that we can help the family make progress and reach the goals they need to either reunify or to allow CWS to close successfully with that family. And so we do that in multiple ways. So for example, we have someone called an intake coordinator, and she's actually co-located at our child welfare sites. So she acts as the liaison between child welfare, protective service workers, and our program, so that we can discuss cases or whether or not a family might be a good fit for our program. We offer monthly letters to social workers on any open child welfare cases that we share, so that we can communicate with the protective service worker on what the family is learning, how they're progressing. So that's really beneficial as well. We also communicate regularly in what we call child family team meetings, which is an opportunity for all the service providers to get together along with the family through a child welfare process that's facilitated by either them or a local agency to discuss how their case is progressing, maybe any kind of barriers that need to be addressed. So that's really an opportunity for us to work together as well. So we have lots of chances to work with them, and it's been a great collaborative process.
Thanks. Yeah, that's really exciting. My favorite, there's a lot of examples of successful collaboration. I think that, well, at Safe Families, we say that we work best in partnership with other agencies that are providing supportive services, and that we don't have county contracts, so all of those agencies refer to us. That's how people even find out that we exist, is like through those relationships and the rapport that's built with staff that are serving clients on a day-to-day basis. So my favorite example of successful collaboration is late in the evening, we received a hotline call from a substance abuse treatment facility in North County, San Diego, and they were helping a mom, and she had been in treatment for several weeks, but she failed her urine test. And she was distraught and totally ashamed and very much in crisis and needed help. And she had a 3-year-old son there with her, and they were going to work with her. They were going to help her phase into a 10-day detox program. And she was wanting to do that. And she was calling her mom and her sister to care for her 3-year-old son, and they were unavailable for her. So she's absolutely panicking because her typical support system is not able to support her during a profound time of need. And so the agency workers are mandated reporters, and so they did their job. They called, and a social worker from Child Welfare Services came out to evaluate and do their job and uphold the standards that need to be upheld during these kinds of situations. But what was great is that they made a secondary phone call to Safe Families to see if we could offer any help. And so it was late in the evening. We posted the need. We've had kids hosted within 2 hours before, and this was one of those instances, which I'm proud to report to you. So we were able to have not one but 2 host families. One could help right away, and one was like, I can be a backup if anything changes. So that was really great. And so our staff came. It was me that night. I met the Child Welfare Services social worker, and she was like, can I meet your host families? They came, completed paperwork. It was mom's decision. She was like, okay, I'm good. And then she got to introduce them to her son after several hours of being together as her friends who would care for him for a few days while she went to the hospital. And then 10 days later, when she phased into residential, no red tape, he's right back with his mom, and they keep into host family, and this mom and son keep in touch to this day. So just like a beautiful story of multiple entities collaborating and just believing, like everybody just wanted to champion and support this family, and there was just this willingness to think outside the box and be open-minded for, could there be multiple solutions, and could we work together on this? And just multiple parties saying, yes, we believe in her success. We want to keep this little guy safe, and we want them to be together, because that was within reach for her. That's accessible for her. And Child Welfare Services, it was like, we see you as a safety plan. This is great, has our full blessing. We have a line of sight on it. We're paying attention, and it was good. So that's my favorite example.
So I already mentioned with regard to the Dad's Core program, we do utilize our local schools, and it's one of those things that I think it's taken for granted in terms of kind of how schools can then impact change even when it's outside of their normal time frame. And so, the Dad's Core program oftentimes is in the evenings. As I mentioned, we provide dinner, there's childcare available, but it's one thing to build it, and it's another thing for people to come. And so in some of the school areas that we've been in, we've seen principals transition into other roles, which often happens. But the administration team that is around them has seen the value of these programs and has consistently welcomed us with open arms, because they've seen that there aren't very many fatherhood initiatives here locally in town, and for those that there are, they may not regionally be accessible for the fathers that they see or that they work with. And so that is one of those examples. But an area that we've been gaining traction is once again trying to reach fathers where they are. Where are fathers who are military connected? They're on base. I don't want to tell you that it is the easiest thing in the world to gain base access, but what I will tell you is that by consistently showing up and by utilizing the networks that we've created, we have had opportunities to provide half-day workshops for some of the fathers who are at our local bases. One in particular, MCRD, Marine Corps Recruit Depot, has really allowed us to bring in abbreviated versions of this initiative. And, what it really lends to is understanding their work life and creating balance. And so creating an opportunity where they can come in on a Saturday morning, engage with us for a 4-hour session, gain some of the tenets of the program, and then have the ability then to see value in it and reconnect with us down the line. And so we have seen fathers who will go to one of those half-day workshops, and then we'll see them in a full 6-week cohort in an attempt to have them gain more of the parenting skills, but also more of the social connections that we alluded to earlier. So that probably is my success story.
Thank you. So I'm going to really mix it up. I want you to hand the mic to Alyssa, and I'm going to close it out. Alyssa, then you'll hand it to Shannon, and then we'll hand it back, and you'll close it out to me. So, what do you know now that you wish you knew then, as you entered into this field?
Oh my goodness. Well, so I'll just be super real. I think our values at Safe Families are just really hospitality, creating places of safety for kids, and compassion, and just unconditional compassion. And I think sometimes I am just a lover of control. If I am being honest, I would just love, and I love to fix. And so when we see situations that are really hard, sometimes in my mind, I'm like, oh, I know you know, like it's my own agenda of like how I would, like what I think that someone that I'm working alongside needs. But just through being, I think continuing education is so vital, and events like this today where we're coming together with the intention of I'm going to be open-minded, I'm going to learn what are other people bringing to the table, what are others saying is important. And I think what I wish I knew then is that I even think it's like still an ongoing lesson, just because it's hard when you're watching somebody just really have a hard, like there's multiple struggles, or like even like self-sabotaging behaviors, and you're like, no, but just recognizing like that I can't fix, and that's not my role. My role is, our role is to be a place of safety, to do what we do and to do that well, and then to allow the parent to choose the path that they want, that recognizing like they are an autonomous adult, and not attaching my measures of success to like certain expectations that may not come through, and really attaching my measures of success to doing what we're supposed to do well, and like remaining in that wheelhouse, remaining in my lane. Because I can like try to be a case manager and an expert in all these fields, but I don't have to be that. And there's no pressure to try to be that. So that's a curveball question.
Well, I would say it was the pay, but the reality is I always knew I wasn't going to make my fortune in social work. I think that, when I was going through school, the whole concept of evidence-based practice and evidence-based models just wasn't there. You were really taught about being eclectic, and it was about finding techniques and strategies that fit the family. And I think that, luckily, I do feel like I kind of came into the game of evidence-based practice pretty early on, but I wish I would have known back then how valuable evidence-based practice really is, and how it really can help any family. Of course, you have to consider some of the things that Charles mentioned in terms of cultural factors, and whether or not it's a good fit for the community, but I've really seen the results that can be made through evidence-based practice, and it's been amazing.
Thank you.
Last but last. So, for myself, I came into this role about 3 years ago, and from my own background, I've had a nonprofit background, but that didn't always lead to working with a military audience. And so what I wish I knew then was just the fact that, population by population, oftentimes we perceive that there's a need for a special approach, and sometimes that's true. But oftentimes when working with a lot of the families, they're families, and that is the core piece. And how would you like to, work with your client or your participants and make them feel like they're in a welcome, warm environment is something that, you can overcomplicate it to the nth degree, but at the end of the day, they're people. And so, when it comes to this process of being connected with Dad's Core and working towards becoming more evidence-based, I think, for myself, it lends to, being your authentic self, knowing that you don't need to know everything, as you mentioned, listening to your audience, because they will tell you what you really need to hear. And that's good and that's bad sometimes. But it's really all good, because you have the ability to pivot, to pilot. And with piloting, document what's working well, what's not so great in your approach, and work towards finding measures to kind of create bridges. But I guess last but not least, it comes back to, utilizing that language piece. We talked a lot about, all of us, the 5 protective factors. We've talked about getting to the level of our audience. Some language will not reciprocate in those we're trying to affect change in. So how can you break down topics, concepts, or just speak to them about, some things that they may be able to engage. And so, it's more of the don't overcomplicate the process with evidence-based, follow a structure, a curriculum, the follow through, and then look at your data to see if you're actually making change.
So hold on to that mic.
Sure.
So we're at that point of the panel discussion here that I want to check in with our online audience to see if you have any questions for the panel. And while we're waiting for those questions to appear from you in the chat box up here, I'm going to look to the San Diego room here to give you the opportunity to ask any questions to the folks up here. All right. I guess you did such a great job that you told everybody that everything they need to know. And I'm just looking at Lydia over here. And I don't see any folks. Nothing today.
I think there was a question for Kim that someone had asked.
Oh, well, we'll entertain that question here.
So someone wanted to know, okay, sorry, about, actually, I need a microphone so that I can.
Oh, that's right. We only can do one microphone at a time or else the system implodes.
So someone had asked what, someone wanted to know about the 211 resource, domestic violence, I think, resources on child abuse prevention, program support groups. I think they wanted to know how often it's updated with some of those things. Some of the resources listed haven't been updated and have not been reviewed for a year or more. Was there a process to do that annually? Or how does that work in order to provide, hold on a second, sorry about this, accuracy in resources for people doing some of this prevention work? Okay. Actually, Amy Zeitz from the YMCA will answer this question for us.
Get you off the hook on this one, Kim. So is this question specific about San Diego's 211? Because I believe all 211s have different sort of processes that they utilize. So if someone is not from San Diego, I would suggest that they reach out to their 211 and find out about that. Our 211 here in San Diego does review those and update them annually, but they can also be updated at any time. So here locally, our county contracts require 211 posting updates. So I don't know if other counties are having trouble with that. That might be something they look at to make sure that those resources are as up to date and accurate as possible.
Okay. All right. So we're at a point of, I'm checking in the room for questions. Thank you very much to the panel. It was very informative and helpful to me personally. I always learn a little bit more every time I participate in a learning community. So we're at the point of the day where we would like to just take a very small break, but we want you to come back. And what we're going to do is a networking cafe. And I'll tell you why we're going to do this. Remember the 5 whys that Charles introduced to us? I had never heard that presented that way. That was very helpful. The reason why is because when we part, we have learned that everyone naturally comes together and they have conversations. And our prior learning community, which was in Los Angeles at the Richstone Family Resource Center, I'm going to shout it out to the Jolie Mason, who's online right now, I know, who made it possible for us to be at that beautiful Family Resource Center in downtown Los Angeles. We just know that people want to network. And what we want you to do with us before we part is to be part of a networking cafe that's got opportunities for you to sit with folks that you don't normally get to know in this room in San Diego. But online, we're going to have it in what we call a breakout room. This is going to be a new approach that we are going to practice today, and I really appreciate you working with us to practice this approach today. So about 5 minutes, we're going to come back and get into our networking cafes, and I will give you the prompts on how we'd like you to exchange information, okay? 5 minutes. Thank you. Huh?